welcome to High Levels with Shay. This is our podcast here. We're going to wait for everyone to climb in today. So I'm going to give you all a minute to climb in as we are going to be going over Bell's palsy. And we're going to be going over some cures and some home remedies for Bell's palsy. So I'm going to give you guys a second to climb on in here. We went over on the lab the other day where we was discussing viral diseases, and we were discussing how to overcome those viral diseases and how to strengthen your immune system. And so today I do want to take the time to talk about Bell's palsy, because that was one of the things that you all mentioned as we was on our last live, and we was talking about the virus that's going on out here. We was talking about the influenza and the pneumonia era that we're in right now. I gave y'all some great gems. I gave y'all some great herbs on those particular topics. And while we were doing that particular live on those topics, so if you missed that live, make sure you go to my YouTube channel at Higher Levels with Shay on YouTube and subscribe, because we did go over that live. I see y'all climbing in now, so come on in and make sure y'all are hearting and sharing this live, okay? So again, if you missed the live that we just did, well, I gave y'all remedies and I gave y'all natural herbs to cure yourselves of like the cold, the viruses, the pneumonia. That is on my YouTube channel at Higher Levels with Shay on YouTube. Now, it was a popular demand for me to go over Bell's palsy. So today, that's what I'm going to do. I told you all I was going to go over Bell's palsy today, and that's exactly what I'm going to do. So I want y'all to make sure y'all are sharing this live, liking this live, and let's get into Bell's palsy. Bell's palsy. All right. So first of all, what is Bell's palsy? Let's start off with that. What is Bell's palsy? Well, Bell's palsy is a neurological disease where a lot of your cranial nerves are affected, and it can be due to a blockage caused by infections. And when I say caused by infections, I mean infections like the influenza, chickenpox, viruses. And again, we went over viruses. So if y'all missed that lab, we discussed viruses. Y'all missed a lot. We talked about how to cure viruses. We talked about how to strengthen the immune system. And again, if you missed that lab, I did post it to my YouTube channel. Now, you all know I don't usually post every one of my labs, but I did because you all asked me to. So I posted that one to my YouTube channel at Higher Levels with Shay. And make sure y'all go subscribe to my YouTube channel, because now that I'm thinking, I might post this one as well. I'll post this one as well, okay? So let's get into Bell's palsy. Again, so Bell's palsy is a disease process that affects your cranial nerves in your face. It's kind of like a like temporary paralysis of your facial muscles and your facial nerves. And so when you feel yourself having symptoms of Bell's palsy, just full disclosure, if you ever feel like you're going through Bell's palsy, make sure you go see a primary physician immediately, because they kind of mimic those of a stroke. All right. So some signs and symptoms of Bell's. Well, before we get to the signs and symptoms, let's discuss some of the things that causes Bell's palsy. Like I said, influenzas, measles, chickenpox, and shingles. Those are viruses that attack your neurovascular system. So just in case anyone didn't know that, thank you for tapping the screen. So tap the screen, heart the screen. So if I'm saying anything that you all are liking, do me a favor and make sure y'all are tapping the screen, okay? And hearting the lives. So the shingles, measles, chickenpox, all of those things, viruses attacks the neurovascular system. And so if you are somebody who's prone to always getting sick, prone to viruses, you have shingles, you always getting, yeah, we're going to get into that. You're always having cold-like symptoms. I encourage you to go to my YouTube and watch that last video on viruses, because this is one of the main causes of Bell's palsy. Another cause of Bell's palsy that a lot of people don't realize is stress. Stress is a silent killer. And stress is one of the main causes of Bell's palsy. And why is stress one of the main causes of Bell's palsy? You to suffer those signs and symptoms of Bell's palsy or being diagnosed with Bell's palsy is because of your blockage in your circulatory system, like your vessels, your arteries. All right, and those blockages comes from poor dieting, cholesterol, and like I said, stress, a lot of tension on those vessels. A lot of tension on those vessels can decrease the blood flow. And a decrease in the blood flow to those cranial nerves and to the brain can cause blockage. And it can also cause Bell palsy. Okay? Now, we're going to get into some cures because someone's in the comment asking, is there a cure? We're going to get into that. Make sure y'all are sharing this live because I do not want to go over the cures for Bell palsy, and I do not want to go over different herbs for Bell's palsy and then someone else missed this live. So please make sure y'all liking, make sure y'all sharing and hearting this live. And again, I will be posting this live to my YouTube channel at Higher Levels with Shay. You're welcome, Tippy. I will be posting this to my TikTok channel at Higher Levels with Shay. All right. So go ahead and like the live, and then I'm going to go over some signs and symptoms of Bell's palsy. And again, anybody who's new to my page, I am a bachelor's degree registered nurse. I've been in the medical field for over 15 years, and now I'm a certified herbalist. Been practicing for 3 years, and I grow my own fruits and vegetables and herbs, and I take a more holistic approach. Although I know the modern day medicine approach, I prefer the more holistic approach. So we on this live, and we talk about our bodies and different signs and symptoms, different disease processes, and how to cure it with our natural herbs. And those herbs, I've had some testimonies, people come back saying this work, that work, can you go over this diagnosis next, can you go over that diagnosis next? And a lot of times I post my lives to my YouTube channel, and sometimes I don't, but depending on the topic, like when I did HIV and herpes, you know, I was like, okay, everybody was like, can you please post this one? I did one on chronic kidney disease. Somebody asked when I post that one, so I posted that one. I did one on lupus and cerebral palsy and multiple myelomas and different cancers. I did one on female and male reproductive system. So those particular lives I posted to my YouTube channel. Some other lives I didn't post because it got so deep, and because, you know, some people came on and get their testimonies and they were so intimate and so personal, I didn't want to share those lives. But I do welcome people to come in. You can request to come up if you have any questions. So if you have any questions pertaining to Bell's palsy or pertaining to stress as a whole, you are more than welcome to request to come up and ask me any questions, okay? So let's get into it. Now, some signs and symptoms that you're going to have is like, I got this diagram up here, like eyelid drooping, eyebrow drooping, I should say, your eyelids drooping. You will have a twitching in your face, and then you'll have this lip drooping. And so you see how like one side of your face is symmetric and the other one is asymmetric. And so a lot of times those can mimic a stroke, or what is called a TIA, right? And that's like a small minor stroke before the major stroke. And so if you start to even have signs of Bell's palsy, it is pertinent for you to go and seek medical assistance immediately. Don't try to do any herbs. Go seek medical assistance immediately because you may be having a stroke. And there are certain medications that they can do, like clot blusters, they can give you to alleviate you from passing away. All right? So, but with Bell's palsy, some things you're going to start having is like some mild weakness on one side of your face. When you smile, you're going to see, like, you're going to notice that one side of the face feels a little heavier than the other side of the face. You're going to have trouble closing your eyes, like, really, really tight. So try closing your eyes really tight. And if you know that you have weakness in one side and the other, that should be a concern for you. You're going to be drooling. You're going to have some drooling that you didn't realize, you know, that you aren't able to control. You see what I mean? How we able to maintain our saliva in our mouths, but with Bell's palsy, you begin to have some drooling, okay? You're going to have some pain around your jaw, around your jawline, your jawbone. You're going to have pain in your mouth, in your teeth, in your gums. And for the life of you, can't understand why it's only on one side of your face. You see what I'm saying? So those are some of the things you're going to go through. You're going to have increased sensitivity on one side. When I say increased sensitivity, I mean the touch hurts. It almost as if someone like hit you on the side of the face. And that's because your cranial nerves are being negatively affected. And so it's going to be extremely critical. It's going to be extremely painful. Okay? So something as simple as touching, something as simple as eating is going to cause you to have some disarray. You're going to have headaches. You're going to have loss of taste. You're going to have twitching of the lip. See that facial twitch? Uncontrollable twitching. Those are some of the signs that you're going to be suffering when you are experiencing Bell's palsy. Now, how long does Bell's palsy last? Because I see people in the comments, people asking me about a cure. Some people are asking about, not necessarily a cure, they're asking, is it chronic? The short answer is no. That's the beauty of it. Bell's palsy is not chronic. Signs and symptoms of Bell's palsy begins to alleviate after about 3 to 6 months. All right. So after about 3 to 6 months, the signs and symptoms of Bell's palsy begins to alleviate. And you have some celebrities who suffer from Bell's palsy. I remember, what's her name? Tracy Ellis Ross, Diana Ross's daughter. She played Joan Clayton on Girlfriends. In some of those episodes that she did of Blackish with Anthony Anderson, you will notice that she had some facial drooping and she suffered Bell's palsy. What's the other actor name? He's Sylvester Stallone. Even Sylvester Stallone, he suffered Bell's palsy. And so stress, a virus, blockage of the cranial nerves, those things will do that to you. Okay? Now, what do you want to do? See, because I know a lot of people are going to be saying like, well, how do we prevent it? If you catch a virus, if you catch a cold, well, you could. You can boost your immune system up. You can boost your immune system up. So, let me say this. You begin to alleviate signs and symptoms of Bell's palsy within 3 to 6 months if you do exactly what we're going to talk about now. Because now we're going to talk about lifestyle changes. That's what we're going to get into now. Bell's palsy is not to be confused with cerebral palsy. Now, cerebral palsy is chronic. Cerebral palsy is long-term. Cerebral palsy is something a little bit different than, well, a lot different than Bell's palsy. Although it's still affecting the cranial nerves, that is something that is long-term. Okay? So, just want to make sure that I said that to you, okay? So, again, Bell's palsy is not to be confused with cerebral palsy, all right? There is no known, cure for, there's no I got to take this medicine and get rid of my cerebral palsy. It's all about your lifestyle change. It's all about boosting your immune system. It's all about you taking the necessary precautions to, make sure that you don't contract any virus, as well as eating the right foods. So if you've had Bell's palsy for, I'm going to go ahead and stretch it and say more than 8 months to a year, that's not Bell's palsy. I don't want you to be confused with it being a TIA or a stroke. Okay? So if you are someone who's having signs and symptoms of Bell's palsy and it's been going on for a year, 2 years, 3 years, 15 years, 18 years, 20 years, that is not Bell's palsy. More than likely you suffered a stroke unknowingly. And this is why they say that stress is a silent killer. You see what I'm saying? This is the reason why they say when you are having signs and symptoms of a stroke to go seek assistance. You know what I mean? So when it comes to you having these symptoms, and we're speaking specifically on Bell's palsy, there are things that you can do. You see what I'm saying? And some things that you can do is you can change your lifestyle, change your diet, boost your immune system. You see what I mean? And what I mean by boosting your immune system is eating properly, eating the correct diet. Okay? And I do have some herbs that I wrote down here so that you all can look up yourselves and you can see exactly what it is that you can do and incorporate these herbs into your diet. The way you incorporate these into your diet is you can consume it as a tea. You can consume it as a soup. All right? And I know somebody asked me to go over Bell's palsy because she said that she had been suffering from it. And I hope that she is on this live. I hope that she's on this live. You see what I'm saying? So somebody in the comments saying my cousin has been having Bell's palsy since 3 and is now 46. That's not Bell's palsy. And somebody in the comments says y'all need to seek a neurologist. It's not one size fits all. See a neurologist. So go and seek, a neurologist. Go see a neurologist about that. You see what I'm saying? So again, I do have some herbs here that I wrote down and that I have researched myself and I know. So what I want y'all to do is write down these herbs. All right. And make sure y'all do y'all due diligence. And I want to make a full disclosure. So before y'all consume these herbs, make sure y'all do y'all own research on the herbs. And make sure that y'all talk to y'all physician, because some herbs can affect y'all medicines. Like if y'all take other medications or if y'all have any other pre-existing diagnosis, okay? So I'm gonna invite her to this live because I don't think she's on it. All right, so some of the things you could do to alleviate your signs and symptoms of Bell's palsy. Again, like we said, change your diet. But I do want to talk about these particular herbs that I have here. All right, so I need y'all to have y'all pens and y'all papers down and heart this live, like this live if y'all are ready for these herbs. So if y'all are ready to write down these herbs for Bell's palsy, heart this live, like this live. All right, let me know when y'all ready. Let me know when y'all are ready in the comments. Heart the live, like the live. And make sure y'all share this live because I do want to make sure that everybody get these herbs down. Thank you, Shelly. I do want to make sure that everybody's getting these herbs. Everybody's getting this information. And do your own research. You know what I mean? Do your research and look up the herbs and see how they're going to affect your body. And a lot of these herbs do a slew of different things. So it's not just for the neurovascular system. They're going to detox the gut. And they're really going to, you know, be substantial to you. So I want y'all to write down these herbs and make sure that y'all are sharing this live. She said I can't see the charts. All right, let me move over a little bit. Can you see the chart now? All right, can y'all see the chart? You're welcome. And for the people in the comments who saying that somebody had Bell's palsy for these many years, that many years, this and the third, that is severe nerve damage. That is severe nerve damage. And at that point, at that point, how can I say this nicely? Well, let me go back first. Take a step back first. If you have Bell's palsy and you first start having signs and symptoms of Bell's palsy, you need to react immediately and swiftly for those signs and symptoms. Now, whatever you or your cousin or anyone else is going through or experiencing, then they have severe nerve damage. It's not that they're experiencing Bell's palsy for those many years. So I've been in the medical field 15 years and I have 3 degrees. And so I'm not here to debate with somebody who may not even be in the medical field just because they have one family member or themselves that's experiencing something, because not everybody goes through the same thing. What I am saying is Bell's palsy itself is not a chronic condition. Now, if you suffer permanent nerve damage or severe nerve damage, that means that you or that person did not respond and react in a timely fashion, and so they now have nerve damage. Now they have Bell's palsy. There's a difference. So I just want to make sure I make that point clear, because I don't want people reading these comments and then just taking taking that wrong advice. Overall, go seek an assistance. Oh, there she is. Thank you. Welcome, welcome. So we went over Bell's palsy a little bit, and she said it could come back. Now, Jeep, that is a great point, and I will be talking about that. So I'm glad you made that point. Let me answer Mika first, Jeep, and then I will get back to you. You know what I mean? So we're going to get to the herbs. So go back to Mika. So what you missed, and if you're just now tuning in, I will be posting this to my YouTube. So make sure y'all follow my YouTube channel at Higher Levels with Shay, and go subscribe to my YouTube channel, okay? So what you missed, Mika, we talked about Bell's palsy. We talked about the cause of Bell's palsy. We discussed the signs and symptoms of Bell's palsy. And we talked about the definition, the pathophysiology of Bell's palsy. And so just to kind of summarize, we talked about how viruses like shingles, chickenpox, measles, mumps, those things can affect Bell's palsy due to the attack on the neurovascular system. And we also discussed how stress can play a huge part in Bell's palsy. And we talked about how stress relates to Bell's palsy. And so we went over a few of the signs and symptoms. And so someone said they couldn't see the chart. So I moved over a bit and showed the chart. They have the drooping of the eyebrows, the eyelids, the lips, and then you have facial twitching, muscle twitching, things of that nature that you will be experiencing if you are having like signs and symptoms of Bell's palsy. Again, I encourage everyone to, if you start feeling like you are experiencing Bell's palsy, facial twitching, uncontrolled facial twitching, you smile and it isn't symmetrical, you're closing your eyes tight and it isn't symmetrical, you raising, lifting your eyebrows, wiggling your eyebrows and it isn't symmetrical, wiggling your nose, it isn't symmetrical, start having facial pains, mouth pains on one side, those are very alarming signs and you must seek medical assistance immediately. If you do not seek medical assistance immediately, then you can suffer permanent nerve damage. Now, because there's some people in the comments saying, oh, that isn't true, it doesn't go away. And it does. If you properly treat Bell's palsy and you probably take care of yourself and take the necessary steps, you can be free of signs and symptoms and eliminate the risk of reoccurring Bell's palsy in 3 to 6 months. You know, if you are suffering from Bell's palsy or a family member suffering from Bell's palsy and it's chronic, that's not Bell's palsy. That's called permanent damage, nerve damage. You see what I mean? And so you suffer from permanent nerve damage. That's a total difference. Thank you all for the gifts. Thank you all for the hearts. Listen, I've been doing this a long time. I've been doing this a lot of years. And I'm not one of the people who is afraid to say, I don't know anything. You know what I mean? Like, I'm not a dentist. You know what I'm trying to say? And so there's some areas where I just, you know, I am very, very privy to. And then there's certain areas that I wouldn't even touch. Like, don't ask me anything about open heart surgery on a child. I don't know that. I know everything about the pathophysiology as the body as a whole, all of our vital organs, and how we can keep those our organs and maintain the health. And if they start to have signs and symptoms of deterioration of those organs or our body systems, I know how to give you guys the herbs and the proper education on how to boost that up. So I wouldn't talk about anything that I don't know about. And so for those people who were in the comments, I appreciate your feedback, but I like to correct inaccuracy. All right. Somebody said, I helped the guy at work. He had it, got his face back in 2 weeks. That's what I'm saying. The signs and symptoms could alleviate, you know. And I'm going to go back to answer someone else asked a question. So make sure y'all are sharing and hearting and liking this live. Somebody, Jeep, let me see what Jeep says. So I got to go scroll up. Jeep, what did you say? Oh, Jeep, I don't know why I don't see your comment. All right, well, I don't know where your comment disappeared to. I know you said something, but I can't. Okay, she said, this happens to me. I went away and it went away. And my doctor said it came back because I'm older. Do you agree? Absolutely. And not even necessarily just because you are just got older. Things in your life may have changed. And like I said, it could have been a viral infection that you had. I don't know if you have shingles, measles, mumps, cold, flu. Any of those things could transpire. Could have transpired taking place to cause you to have signs and symptoms of Bell's palsy again. Now, if you're comfortable, can you write in the comments, do you still suffer from signs and symptoms of Bell's palsy? Are you still suffering from those signs and symptoms? Like, how long ago did this happen? And do you still suffer from any signs and symptoms of that? So it could come back. And the scary thing about Bell's palsy is it's almost like once you contract it, your risk of it reoccurring, especially if you have not made a lifestyle change, is significant. And so it's one of those things, like, once you catch it, you got to be careful because it can come back and it can come back and it can come back. All right. The beautiful thing about it is, no, there isn't a cure, but it alleviates. It's short term. It is not chronic. And if you have chronic long-term effects from it, that's permanent nerve damage, and that is in Bell's palsy. All right. Somebody said, I helped the guy at work. I saw that. What's good for the prostate in men? Victor, go to my YouTube channel at Higher Levels with Shay. I did post that on my YouTube channel. We went over prostate, we went over erectile dysfunction, prostate cancer. We went over BPH, that's benign prostatic hyperplasia, the enlargement of the testes. We went over infertility in men. All of that is on my YouTube channel at Higher Levels with Shay, so you all could subscribe. And I will be posting this particular video to my YouTube channel. Somebody said my eyelid is drooping right now. If your eyelid is drooping right now and that is a new onset condition, you never experienced that sign in something before and you started having an eye drooping, but the rest of your face is symmetrical, then I still want you to go and seek, you know, a physician right away. But make sure it's not like just an eye infection. You know what I mean? I don't want anybody getting on here and, you know, getting nervous. But make sure you just don't have like an eye infection, a pink eye that's causing your lid to kind of close, because your lid is a defense mechanism, okay? So we want to make sure we be mindful of that. She said, when I took ibuprofen once a day, my BP was better. You know what else treats blood pressure? Is garlic. Garlic is a natural blood pressure depressant, so is greater burdock. And those are all herbs that you can just, you know, use in your teas. So, but garlic is a natural blood pressure depressor, and it will lower it without anything else. All those medicinal uses. All right, so lifestyle changes. Let's say we started having Bell's palsy. We start having signs and symptoms of Bell's palsy, facial twitching, drooping. It feels tight on one side. It's very sensitive. Nerve pain on one side. To mouth aches, eyelid drooping. We don't know what's going on. One thing's first, water. Second thing, vegetables. Third thing, eliminate alcohol, eliminate drugs, eliminate processed foods, eliminate fast foods, eliminate red meats from your diet immediately. Get rid of those. We're going to make sure we get all that calcification off of your neurovascular system. Okay? So eliminate the risk factors of calcifications and get it off of your system. All right? Next thing we're going to do is we're going to consume our water. We're going to consume our vegetables and our herbs. Now, some simple herbs that we all should have in our cabinets, maybe not. I do. Cilantro, parsley. Cilantro and parsley are notorious for being able to deep cleanse the neurovascular system, okay? So cilantro, parsley, celery is a vegetable, but I'm just saying, you know, some of the vegetables that you all need. Reishi mushroom. Turkey tail mushroom. These are some of the herbs that you need. All right, and some of the foods you can take. Now, some other herbs that I have written down here. You guys heart this live. I think we only had 3,000 likes. And I'm giving you all gems here because this is just what I love to do. And I want you all to follow my page. And as I'm talking about these herbs, put in the comments, what do you think I should talk about next as far as holistic approaches in medical disease processes? What do you think? We talked about flu and virus and pneumonia and the C word. Yep, that's what did it, G. I'm going to tell you that now. We also did a lab on blood type. The 4 blood types, and eating, you know, the appropriate foods for your specific blood type. And you have to be mindful of what you consume in your body as a whole. So we absolutely did that. All right. And so if you start a carnivore diet, you are putting a lot of lactic acid into your body. A lot of it. And again, I always tell people, a lot of this meat isn't even real meat. It is not real meat. So you want to make sure you're being very careful about that. All right. All right. And we're going to get into the rest of these herbs. So I'm going to continue giving y'all more of these herbs that I have here that I wrote down. And I want you all to make sure y'all are writing this stuff down, okay? And then make sure y'all let me know what topic y'all want me to discuss next. But we're not done with the herbs. We're not done with the herbs. All right. Y'all ready to get back to the herbs? Evening primrose. Evening primrose. Evening primrose. There's an herb called skull cap. That is a real herb. It is called skull cap. Cottonwood. Thank you all for the hearts. I really appreciate it. Cottonwood. Valerian root. Valerian root. Butter burr. Like butter and then B-U-R. Butter and then B-U-R. And I think I said evening primrose oil already. Fireweed. Fireweed. Thyme. Thyme is a herb we have in our kitchen. Thyme is amazing for helping us to detox and cleanse the neurovascular system. Now, I do have a few more herbs that I want you all to write down, but is there any questions so far? Are there any questions so far about these herbs? Any questions? Or I could, you know, continue on with the process. Oh, you know what else? Peppermint. Peppermint helps with pain. It alleviates pain and it helps to open up our sinuses. And the reason why I'm saying peppermint is because you have a cold and you have a flu and you have a sinus headache that is clogging up your sinuses, and then it starts to affect your neurovascular system and cause that's the temporary facial paralysis. Mint helps to open up your sinuses. Mullein, M-U-L-L-E-I-N, opens up your sinuses, open up your respiratory tracts. It helps you to expectorate the mucus out. And mucus buildup is due to acid buildup. Okay? So you on a red meat diet, I encourage you to stop now. You eating all those saturated fats and all those processed sugars, not simple sugars, not natural sugars that you get from your fruit. Those processed sugars, the cakes, the ding-dongs, whatever they call, ho-hos, and all those. So you need to be mindful what you put into your body, because it's going to cause acid buildup. Acid buildup is going to attack your neurovascular system. Neurovascular system is going to attack your mobility as a whole. But right now, we're not going to talk about mobility as a whole. We're talking about just the facial mobility, the facial muscle mass, and the movement of the faces and the cranial nerves. And thus, we're focusing on Bell's palsy. Yes, valerian root does help. Yep, it does. Valerian root helps with anxiety. So that's just the general masses of it. It helps with anxiety as a whole. And so in turn, when you are alleviating the signs of anxiety, you're going to have a sense of calmness and peace that comes over you. And it's going to help you to relax because it's calming down your brain. It's preventing your synaptic nerves from firing off rapidly when you thinking about millions and millions of things. So it kind of relaxes your brain and keeps you a little bit grounded. You know what I mean? It's not too late, Jeep. You got to give these things some time. And I'm going to be completely transparent with you all. About a year and a half ago, I suffered from slight Bell's palsy. Me being in the medical field, I already knew what it was. So, you know what I mean? But it took me, I want to say about 5 months not before I started to see these signs, alleviate, because they started to alleviate after like month 2 or 3. But it took me about 5 months before my face came back to normal. Like, this side of my face was droopy. When I smiled, only this one went up, this one was down. And I'm just opening up to you all, just being honest. Because I had a lot going on about a year and a half, 2 years ago. And it was not due to my diet, because I eat a pretty good diet. It was stress. I had a lot of stress on me. And when it comes to diet, I will say maybe it's because I wasn't eating really as a whole. I mean, I was eating like fruits and vegetables, but I really didn't have a big appetite. You know what I mean? Suffering after suffering, loss after loss. It was just a lot going on. And I'm building different businesses. I built my own school. You know what I mean? And School of Healthcare, SMG School of Healthcare. I started my own medical business. And so it was just like, it was a lot that was going on at that time. And I woke up one day and then my eye was twitching and my cheek was twitching. And I'm thinking, okay, I'm having a calcium or magnesium deficiency because lack of magnesium can cause muscle twitching. And so I'm thinking I'm having a magnesium deficiency originally. You're welcome. Yeah, you know what, Era? I mean, I think that's important for me to share these things, you know? And so, I really thought it was like a magnesium deficiency. I wasn't concerned because like I said, me being in the medical field, I kind of had an idea of what it was. And, I started consuming more magnesium and that didn't help. Thank you, Karma. Thank you. She said, I'm so happy that your face is back beautiful. Thank you. It was beautiful, but it was like, and I was like, okay. And it was like, okay. So it was crazy. But yeah, I myself had suffered from that. And so this right here is something that's near and dear to me when it comes to this topic. And I'm very passionate about the medical field and sharing this information to you all as a whole. But this particular topic is like, I want to make sure that I let you all know what's going on because it could come back. It could. Like Karma would say, I've had it 6 times. Yes, it could come back. But I take the necessary steps that I do now because although I wasn't eating bad foods, I mean, you can still have a mineral deficiency or, you know, you still have acid buildup when you're not eating at all. And I was eating, you know, but it was just like, I didn't really have an appetite. I was more like a smoothie drink and go, smoothie drink and go, smoothie drink and go. I didn't really care to sit down and eat 3 meals a day or whatever. I was eating like 1 meal a day, drinking my smoothies, my water, and just going. And I woke up one day and I was on the phone and I was like laughing and I realized that every time I laughed, I could only feel this side of my face going up. And so I went to the mirror and I'm like, what is happening? And I did it and I was like, oh my Lord. Like, and I was looking at it and I was just like, and I took a picture of it. I took a video of it and I went back to work and I showed one of my, the neurosurgeon at my job, one of my doctor friends. And I was like, what is this, doctor? You know, such and such. I'm like, this is what's going on. And he was explaining it to me. Yeah, it was stress. It was 100% stress. It was 1,000,000% stress. And he told me what it was. And, I was fortunate enough to just go to work and see him, and he told me like what it was, what to do, how to alleviate it. And again, at this point, I may have been 1 year into herbalism and herbal medicine, so I wasn't like, I was still a novice, you know what I mean? And so when he was telling me about the different herbs to take and this to do and that to do, I was like, oh, this is perfect. And so I started to dive more deeply into it, doing more research. And so I wrote all the herbs down that I know that I did, and I put into my teas and into my soups, and I incorporated into my life. And I told myself that I was never again, because I know that it could be reoccurring, and it could. Once you're prone to it, it's like you got to be really careful. And so I don't want to have to experience that again. And like I said, I started to notice slowly but surely my face was coming back to normal. However, it took about 5 to 6 months for it to completely come back to normal. And I did. I had the twitching. I had the mouth droop. One of my eyes a little. It was like, but I hid it really well. You know, bangs, weave, hair. And then at the time we was wearing face masks. So with the mask on, people couldn't really see, you know. And so at the time, you know, the times was a little different 1.5 years, 2 years ago. But I'm making my mission to make sure that I don't have to experience that again. And that looks like eating properly. That looks like alleviating any stresses in your life. That looks like saying goodbye to negativity. That looks like saying goodbye to fake friends or fake family or fake coworkers or whoever is causing you stress. That looks like saying goodbye to your old self that's causing yourself your own stress. You see what I'm saying? That's what it looks like to make sure this doesn't reoccur again. It looks like changing my diet because I care about my life. And I don't want a long-term life and I'm dilapidated in a wheelchair somewhere, but yet I'm 60 years old and can't do anything, or 70 can't do anything. My life is about quality, not quantity. You see what I'm saying? And I want you all to gain this message from this. Make sure your life is about quality and not quantity. You don't want to be 70 years old or 50 years old or 60 years old confined to a hospital bed or to a wheelchair. And it's really easy to sustain your health when you're young and you continue to maintain a healthy lifestyle than it is when you're older and there's so many different organs that was negatively affected and you're trying to reverse it. All right? So That's what it looks like. It looks like incorporating these herbs into your diet. You know what I'm saying? And so some more herbs. If y'all ready, tap the screen for the rest of the herbs. I don't want to start now if no one is and Pam, you're still young. 50 is so young. Oh my goodness. Yeah, you're so young. Yep. Tap the screen if y'all ready for the herbs. Karma said it takes longer. Every time it comes back. Every time it comes back, it takes a little bit longer. Because you know why? Because even though your nerves, your neurovascular facial cranial nerves have repaired itself, it's almost as if like, think about like if you get a fracture and it heals. But that bone is truly never as strong as it once was before. So you still have to be careful because you don't want to refracture that bone because the second time it's going to take longer to heal. So the same thing with your nerves when it comes to Bell's palsy. It's going to take longer to heal because those nerves are like, wait a minute, I just went through this. I'm still not 100% recovered and now I'm going through this again. And so you are going to suffer and it's going to be longer the next time. I highly encourage you to do exactly what I'm telling you to do now on this live. Please do. Because I'm not steering you wrong. And I don't mind anybody fact checking me. Go Google, research, do whatever it is you need to do. All right? But I want y'all to do that. Sea moss is important. Spanish moss is important. Okay? So you guys incorporate this stuff into your life. We already talked about them lion's mane mushrooms. We talked about the evening primrose oil. We talked about the thyme, parsley, cilantro, peppers, mints. I prefer peppermint to be exact. We talked about, we didn't talk about pulsatilla. Pulsatilla, y'all. Write this down. Pullsatilla. Pulsatilla. Write that down. Write that down. That is going to help you all significantly with those cranial nerves and you just healing your neurovascular system as a whole. You know what I mean? Chickweed. Chickweed. And I will be posting this live to my YouTube channel at Higher Levels with Shay. I will be posting it. Ashwagandha. 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 I gotta see what I'm gonna do live next. Cause I got, it's so many diseases out here in the world in the medical field. We can tackle so many. I mean, and when we talk about the neurovascular system alone, we're talking about Bell's palsy. There's also epilepsy, seizures, cerebral palsy, headaches, migraines. There's also CJD. There's also just lack of concentration, depression. I mean, we talk about neurovascular. We talk about a lot of things. There's also neuralgia. I mean, we just talk about one disease process in one body system, but we can talk about a lot of different disease processes. But I'll think about what we want to tackle next, and we'll see what we want to do next. But I definitely want to make sure I give y'all these this information. Somebody asked me about sciatica nerve pain. But I'm gonna need to add more to it because that's such a simple and short topic that I may end up doing like 3 different disease processes along with sciatic nerve pain, like restless leg syndrome, maybe neuralgia. I'll add those 3 things all in one or something like that. I'll see. You are so welcome. You are so welcome. It's free information. I don't mind. I don't mind. I get on here and just tell you all whatever, and whatever topic we're discussing at that time, and I just ask you all to share the information with other people. You know what I mean? That's all I ask you to do is share with other people, you know? And then the next herb I'm going to tell y'all is winter green. You're welcome. Winter green. You are absolutely welcome, my dear. Winter green. Chicory. 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 I also have my show. It's Higher Levels with Shay. midday show from 12 p.m. to 2 p.m. where I interview guests and we talk about businesses, talk about just growth and elevation as a whole. We talk about Christ. We talk about just building yourself generational wealth. We talk about a lot of things, and business owners, entrepreneurship. We talk about how to alleviate stress, cultivating healthy friendships, pouring into others as they pour into you. Not spreading yourself too thin, having self-esteem and self-worth. We talk about a lot of stuff on my High Level Shade radio show, and that airs on Kingdom Purpose Television and Kingdom Purpose Radio Monday through Friday from 12 p.m. to 2 p.m. And you can follow me on my Facebook page at Higher Levels with Shay. Yep. High Level Shade. So I do a lot of speaking to the community and the masses, and I love it. I love it. And if y'all have any topics or any questions y'all would like me to tackle, hey, send me a direct message. Send me a direct message. I will respond, and I will try to meet your needs as much as I could. I'm here for the people. I'm not here for the profit, and I'm not here for anything else. I'm here for the people. So each one of us teach one of us, and we keep moving forward. Thank you. Thank you. I appreciate it. Do you guys have any questions for me? I know this one was a short live. I think I was only on for like, what, 30 or 40 minutes? But yeah, this one was Bell's palsy. I just want to just tackle it. It is the disease process itself is short term. If you don't do anything about it, you could suffer chronic nerve damage. It's the same equivalent as, sorry to use this analogy, but I gotta be honest. It's the same equivalent as if you have an STI and you don't treat the STI. And it's like, and then you have chronic long-term, you can get HPV, you can get cancer from, like you have gonorrhea or, you know, chlamydia that you don't treat. And then it has a long-term effect. And that's not good, you know? So if you having chronic and long-term effects of Bell's palsy, that means that you're not doing a change. You have to take accountability, because nothing is attacking your cranial system but you. You're attacking your cranial system. Your cranial system is not attacking you. Your cranial nerve is not attacking you. You're attacking your cranial nerves. You see what I'm saying? And so you have to take that accountability, and you have to want to change, and you have to know that you are worth it, and know that you don't deserve to be suffering, you know, those signs and symptoms, especially when it's fixable. It's fixable. It's manageable. So I know it's tough. We want to eat our red meat. We want to eat this. We want to eat that. And hey, I'm not wanting to tell y'all to just stop eating anything cold turkey, but just be cognizant of what we're putting into our bodies. Be aware, and little by little, every day, make that make it your purpose to want to do better. Make it your purpose to, and your mission to want to transition to a better lifestyle. So every day, just try to do better, so that you're not walking around like this for the rest of your life, knowing that it's something that you could have done about it. You see what I'm saying? All right. I'm trying to think of what else we can talk when it comes to Bell's palsy. Is there anything else? Yep, loving ourselves from the inside out and taking care of our temples. That is absolutely correct. That is absolutely correct. 100%. You could take ibuprofen for pain if you like. You can take cloves. Cloves is an herb, and it's a small, like, brown herb. And I love clove because clove is in my opinion, it does two different things. It's an analgesic. So, like, if you bite it, it helps soothe sore throats. It helps with toothaches. It helps with pain. And it also helps to expectorate out mucus, all right? And so I would chew on a clove. I would put clove in my tea, and both of them at the same time. I'll put a couple of them in my tea, and I'll also be chewing on the clove at the same time. All right? I do want to do a live about this upcoming election. We have about 10 days out, and with the election, not necessarily a debate of whose side you're on versus whose side I'm on. Not necessarily that. But With this upcoming election, we all need prayer, significant prayer for both parties. There's evil spewing and there's evil spirits that's going on, and we just need to pray for both parties as a whole. You see what I'm saying? But I do want to go and do a live about this upcoming election, and I do want to weigh in on both parties, pros and cons. You know what I mean? And I do want every American to know that your vote does matter and that this is a very important election. And I highly encourage you all to do your research. Don't just listen to the TikTok stuff and the social media stuff, and don't even listen to the Fox News stuff and all these other CNNs. Go do your own research. Go to each party's website, look at their policies and their political views and their stances, and look at their interviews in the way they're responding to the questions. And listen with a spiritual ear. Open up your hearts and recognize that this is a spiritual warfare that we're in right now. So listen with a spiritual ear, not a flesh ear, and make the best decision. You see what I'm saying? She said that part. Yes, this is a spiritual war. This isn't a man versus woman. This isn't a black versus white, not a youth versus old, not a poor versus rich. It is none of those things that are there to distract us. It is a spiritual war that is transpiring right before our eyes. And it's really in our faces, but you have to be awake and aware. I was doing my live today, and I talked about cleansing the pineal gland. That live I will be putting on my YouTube channel at Higher Levels of Shay as well. We spoke to Cheryl Stabler, and she is the owner of Viry Network and Just Faith Television. She's a very good friend of mine. She's a very good sister of mine. And she's also the founder of the Unshakable Woman podcast. And her television show is over in, not television show, but her streaming Viry Network is in 160 countries. And so she was a guest on my show today. And we were speaking about a slew of things. A lot of things. But one of the things we touched on was this upcoming election. And we touched on the pineal gland. And I always throw in a medical moment on my shows. So we talk about a little business. We talk about a lot of religion. And then we talk about a little bit of medical. And when it comes to the medical, I was speaking on detoxing the pineal gland. And opening up your third eye and decalcifying that pineal gland that is caused, which was... how do I say this? It was calcified, meaning polluted and tainted due to certain injections that we get, that they make us get at 3 months, 6 months, 2 years old, 5 years old, all those, that's crap. And it also is due to our diet and the processed foods that we're eating and a lot of things that we're consuming in our bodies. And so our pineal gland and in our water as well. The fluoride that's in our toothpaste, the fluoride that's in our water, that clogs up the pineal gland, and it keeps you from being able, thank you Jeep, and it keeps you from being able to really see what's going on right in front of your eyes. It's almost as if we're like programmed, or like as if we are in a trance. And when you detox your pineal gland, you're able to see more clearly. And so I put those different herbs and those different necessary steps you could take to help cleanse and detox your pineal gland so that you can be able to see more clearly. And so I just did that show today, and so I will be posting that show on my YouTube channel as well. That show will be posted on Monday, though. So make sure y'all go subscribe. Hit the notification button on my YouTube channel. So when you subscribe, you're going to see that live. And I want you guys to watch the whole live or scroll all the way to the last 20 minutes. It don't matter to me. But watch the part where we talk the pineal gland. But yeah, I think that sometime this week I will be going over this election. So we're going to pause medical for a moment, and then we're going to talk about the election. And then I'll get back into medical. I'll get back to my regular scheduled programming, okay? So, I don't know. What do you guys think? Y'all the people, I do it for y'all. I'm here working for y'all. So, what do you guys think? Like, should we just continue on with the medical stuff and just continue with the diagnostic stuff? Or should we just pause for a second and get into this upcoming election for just one episode or one live or whatever you want to call this? What do you guys think? Drop it in the comments. Let me see y'all. And be honest in the comments. Like, we all family here. So what do you all think? Don't forget to like the live. Heart the live. You all are swayed either way. You all are swayed either way. It doesn't really matter whether we do medical or whether we do the election. What are you guys thinking? What should we do? I want you guys' honest opinion. Like I really do. That's true. That's true. Do the election. I think it's necessary. I think it's extremely necessary, especially with, what are we, like 11 days out now? You said yes, you should do it. I think it's important. Somebody said 1 day of election. I think it would be great to speak about the election. A lot of people don't do research. Do 1 day of election. Yeah, and then that's what I'll do. We'll do one topic. We should speak on the election. Okay. All right, then I'll do that. And thank y'all for the hearts. Thank y'all for the likes. Leslie said do medical. Now, so Leslie, I'm going to do medical this week as well. So I'll still do one more medical because I try to do 2 a week, but life gets so busy and then meetings and shows and all this other stuff I be doing. So I try to do 2 a week. So I know I'm going to do one. I'm doing a medical now, and I'm going to do a show on the election, and then I'm going to try to throw in a third live here. While I go live with you all. I just don't know what the topic is going to be yet. Because I'm saving ADHD and autism. And I'm saving that for a special day. Because for those who don't know, my son has autism. And he's actually the reason why I started tapping into herbalism. Because I wasn't going to put him on any medications. And I want to treat him holistically. And now he's 8 years old today. He's talking, reading, writing, doing well in school, straight A student. And so I'll be doing autism and ADHD and ADD another day. Another day, you know? So I will be doing another medical. Thank you for sharing the live. Thank y'all for the hearts. Thank y'all for the likes. I really appreciate it. I really do. And so Leslie, you say do medical. What topic? What topic is coming to mind to you? What disease process would you like to see me do this week? What are you thinking in your mind? We did cancer. We did female reproductive system. We did male reproductive system. We did hypertension, diabetes. We did kidney disease. We did STIs like herpes and chlamydia, gonorrhea, HPV. We did infertilities in women. We did a lot of stuff. We did chronic kidney disease, cysts. We did breast cancer. We did your blood type. We did fibroids and fibromyalgia, multiple sclerosis, lupus. I mean, we tackled a lot. And now today we're doing Bell's palsy. So what else do y'all want to, what else should I tackle? We did the influenza, pneumonia, the vid, you know what I mean? Flu. I'm trying to think, what else could we do? What else could we do? Like, as far as like, do you guys want to go live about any other medical? And thank one of my dear followers here. Yep, we did diabetes. We did lupus. And we did diabetes insipidus. We did diabetes mellitus. We did diabetes juvenile diabetes. So we did all 3 different diabetes. We actually did diabetes type 3, which a lot of people don't know is dementia. Because it's built up sugar on your brain. And so a lot of people don't know that. You see what I mean? And if you get rid of the calcification of sugars off the brain, you can alleviate yourself of signs and symptoms of diabetes. I like that. Hepatitis B. I don't think we did any of the hepatitis. A, B, or C. I like that. I like that. Thanks, Pam. She said hepatitis B. Neuropathy, the thing is, we'll do neuropathy. We did that when we did multiple sclerosis. We did fibromyalgia, neuropathy. That's on my YouTube channel at Higher Levels with Shay. Leslie, we did kidney stones, kidney disease, acute kidney injury, chronic kidney disease, dialysis, shunts, AV fistulas. We talked about all that on my YouTube channel at Higher Levels with Shay. That video is on there. And so I do want to touch back on certain stuff, but then, like, I did HIV twice already, and I did the cancer one twice already, and so that's why I posted to my YouTube channel, because I do want to come up with new content. You know what I mean? Because I do have subscribers to my YouTube channel that watch some of the videos, and so when we talk about lupus, neuropathy, what else is up there? Diabetes, kidney cleansing. We did all those. Those on there with the herbs, and it was very, very, very well informed. Those are on my YouTube channel at Higher Levels with Shay. So I do highly encourage you all to go subscribe to my channel and watch my videos and share my videos. Share them with other people. All right, Jasmine. All right, you guys have some good suggestions here. Let me see. Let me see here. I know what you were saying. I know you were saying high triglycerides levels. I know. Jazz like, wait, let me correct that. No, I get it. I know you're saying high triglyceride levels. Okay. Oh, that's nothing we went over too, Jasmine. We went over lab values and how to interpret lab values, how to read your lab values, because you won't believe how many people I know go to the doctor and they open their My Chart and they read in their labs, but they don't know how to interpret it. They don't really know what it means for the CBC, the CMPs, the complete blood count. They don't know what it means when they look at their hematocrit levels, their BUN creatinine levels, their ALT levels, their liver panels. They don't know what that means. So high triglyceride levels or lipid panels, they don't know any of that. And so I did do a lab where we talked about interpreting lab values. And that too is on my YouTube channel. It's how to interpret lab values is on my YouTube channel. So high triglyceride levels, that's a good one. So when you say systemic inflammation, let's be a little bit more specific here. Because what do we mean by systemic inflammation? We can have systemic inflammation in the bladder, you know what I mean, in the kidneys, inflammation in the pancreas, pancreatitis. So it's not overall body inflammation, muscles or joint. Like inflammation in the joints, inflammation in the muscle, inflammation in the organs. That's what I'm trying to say. Like, because we talked about a few things. So it's not body swelling, like your muscles are swollen, your joints, arthritis, genital arthritis. What are we talking about here? So that one's gonna be a tough one because there's so many, like inflammation in the organs, like I said, your kidneys and then your pancreas, and you know, your bladder can be inflamed, and your abdomen, gastritis can be inflamed. So it's a GI issue. So when we talk about organs, that's a lot. That's a lot to contain into one lab. So I'm going to think about that one, and I'm gonna have to condense it down because you're talking about the entire organ system, the entire body, and all of those systems. And you can have inflammation, and literally inflammation in the heart. You know what I mean? Carditis, inflammation of the bladder, inflammation of, you know what I mean? So I'm gonna definitely have to do them by system. You know what I mean? Definitely have to do them by system. So I do want to make sure I meet your needs, and I do want to make sure that I can tackle this topic for you, Jasmine. But I really, you see, because you're asking me to do something that affects the entire body, but each system responds differently, different signs and symptoms, different disease processes, different prognosis, different herbs. And we don't want, you know, to have a lab where we talk about the heart 1 minute, and then the kidney, and then the bladder, and then your rectum or your GI, and then your, you know what I mean? It's like, yeah, and so it's like all different systems. It's okay, you say it makes sense. Yeah, so you want to make sure that and like sometimes you have an inflammation in your stomach that's called gastritis, then I will completely focus on abdominal pain, abdominal discomfort, abdominal array, and we'll talk about that particular thing, what causes gastritis of the stomach and the lining of the stomach, and how we can alleviate that. So I need to know exactly, what part of the body are you most affected by? You know what I mean? And then we'll go from there. And then DM me like, hey, Shay, can you talk about gastritis? Can you talk about tinnitus? Can you talk about, pancreatitis? Itis means inflammation. And then we talk about which body part it's affecting. Just, can you talk about arthritis? You know what I mean? Osteoarthritis. Inflammation of the joints, inflammation of the bones. So just DM me and say exactly what what organism you're trying to talk about when it comes to inflammation, and then we'll focus on that particular. I don't think so. Nope, I don't have one on pancreatitis on YouTube. I don't think we went over pancreatitis. So I am absolutely open to going over pancreatitis, especially since pancreatitis, if untreated, can lead to pancreatic cancer, and that's a whole different. That is a good one. That's a good one. So I think that we could do pancreatitis and talk about the pancreas and how it can lead to you becoming diabetic, because see, the pancreas produces the insulin that helps you to maintain your blood sugar. So you could become a diabetic because of pancreatitis. You can also get cancer from pancreatitis if untreated. So that one would be a good one, because we can pull on a few different things with pancreatitis. So I could do that. So we got pancreatitis. It's a very serious one. We got pancreatitis, we got the election. So I like those. And I think that was pretty much it, because the other ones you guys have mentioned earlier. Oh, and hepatitis B. So I'm gonna make sure, let me write this one down. So we're gonna do next time. So we're gonna do pancreatitis. And then Now with hepatitis B, I think I'm gonna do hepatitis A, B, and C. That's what I'll do. I'll do hep A, B, and C. Since we already talking about it, let's just go through it. Let's just talk about it, and then we're gonna do the election. So for this week, we're gonna do the election, and we're gonna do hepatitis A, B, and C. And then after that, we're gonna follow up with pancreatitis. All right. I do if you guys want me to. So if you want me to put this stuff on YouTube, like I said, some videos I've done, some lives I've done, I haven't posted to YouTube, but this one I will post to YouTube. If you want me to put the pancreatitis one on YouTube, I'll post that one. I more than likely probably won't post the election one on that one, because that one is more so like I want people to request to come up. Let's have a real discussion and just talk. And this is our house, And when we close the door in this house, that's it. You leave it at the kitchen table. So once we get on here and we talk about stuff like that, we'll leave probably that one off of YouTube, and just kind of have that open quorum and that open discussion between us family. YouTube don't need to know about all of that. But I will be posting the hepatitis B, and I'll be posting the pancreatitis one on YouTube. Okay, I could definitely do that for you all. But you guys the only thing I ask you to do is to, I know, right? The only thing I ask you all to do is to share the information with your loved ones. Share the image with your family and friends. If you watch my YouTube videos and you learn something significant, I do appreciate comments. I appreciate the likes. And I appreciate you sharing my videos to your social media platforms with other people. That way, a lot of more people can see the content and they can get that understanding, okay? The same as you all are gonna get. So this one I will be posting to my YouTube channel today. I could post it today. If it downloads in time, I'll post it today to my YouTube channel. All right. So Bell's palsy, everyone. We got it. We did it. Get y'all some, make sure y'all getting y'all rest, drinking your water and your fruits. You better stay stress-free. Whatever is overwhelming you, figure out a plan on how to prioritize yourself first. And then what's important And anybody who's a distraction in that, they're not worth it. Anybody who is causing you anxiety, is causing you irritability, your spirit isn't sitting right when you got to go call them or go meet with them, they're not worth it. If it costs you your peace, it's too expensive. Because the next thing it's gonna cost you is your physical. And it's not worth it. Y'all are too pretty with too much to lose and too much to live for. All right? I love you all. So I get on here, DM me. If y'all, I know this is public, so y'all can privately DM me if you want to, if you have any ideas or any topics you want me to discuss, and what is medical. And it could be about stress, how I overcame things, and what it looked like me on my journey and how I got through things. You know, I don't mind answering those questions for you all. So just let me know and then we'll go from there, okay? All right. I will see y'all later. And don't forget to tune in to Higher Level Shay on my podcast Monday through Friday on Kingdom Purpose Television and Kingdom Purpose Radio. And you can follow me on my Facebook at Higher Levels with Shay. I love you all. God bless you all. Stay focused. Cleanse that pineal gland. And good night.